Okay, we are live now. We'll start all over again. I'm Dan Hicks, County Judge, and hopefully somebody will text me if you can't hear me or see me. But if you can't hear me or see me, you don't know that I just said that. So I've got Christy Hanley, Chief Quality Officer for Cogdell, and then Bill Dickinson, the Lab Director for Cogdell Hospital, here with me. I appreciate you both coming today. We're getting started a little bit late. We actually got started, but turns out we weren't live, so we'll try it again. I'm going to start with the daily numbers. Texas test is 151,810. That's up from 146,467. Currently in the Texas hospitals, 1,538. That's up from 1,409. Cases reported in Texas is 15,492. That's up from 14,624 yesterday. There have been 364 fatalities. That's up from 318 yesterday. Patients recovered is 3,150, up from 2,580 yesterday. And there's been 184 of 254 counties reporting. In Scurry County, we've had 65 tested. There were 52 yesterday. We have 12 pending. There were 6 pending yesterday, 51 negative, and we have still only 2 positives. So as we talked about yesterday, the numbers have gone up, and there's a reason for that. And that's going to be because we're able to do a whole lot more testing than we were prior to just recently. So you want to tell us a little bit about that, Christy?
We're thrilled to be able to increase our testing capacity. The key to really being able to contain this type of pathogen is to test widely, and we've really been limited. There were issues initially early on with the CDC wasn't able to, like, national testing wasn't even, it had error rates, and they didn't feel confident until, I believe it was January 28th. So that meant, governmental testing or testing through governmental entities was kind of limited and just kind of starting to pick up around the first part of February. And we, in order to have somebody tested, you had to follow very, very strict criteria. Absolutely. And had to have the state epidemiologist check off on it. And yes. It was a pretty complex process. And it wasn't until March 5th that public labs, LabCorp being the first one of those, was able to, they were approved to perform the testing. And fortunately, we already had a contract with LabCorp, so right. That made for a seamless issue there. But because that was the first public lab company that was approved, they started receiving samples from everywhere in the United States. Sure. And before too much longer, they had a backlog, and we were having some extended turnaround times on those tests. So. Okay. So we were still limited. We weren't able to get the viral transport media, which I think Bill can provide a nice visual and description for. That's been a limiting factor as well. Okay. So once public labs were able to do the testing, we have more venues, but then we're still limited by not having the appropriate material to ship them in. Sure. Until we've actually, Bill and I believe Dr. Windish came upon a solution that really kind of opened things up for us here, and I think it's been a real game changer for this community.
Well, that's good. That's good.
Yeah. To expand on that,
yeah.
Let me just look at this paper here. Laboratory Corporation of America was the very first laboratory that the U.S. government actually got approval for actually doing testing. Fortunately, again, we were with LabCorp, and so that was a plus. So we decided to use them. We sent a total of 8 COVID tests to LabCorp, and of those 8 COVID tests, the turnaround time was 24 hours, and then it was 48, and then it was 6 days, and around 8 days, and then around 14 days, which averaged out to be 8 days, which was not satisfactory because they were just inundated with so many tests that we were actually part of that statistic as well. So it was not really effective for us to actually perform any testing at Laboratory Corporation of America, just because it wasn't for the best purposes for our patients here. So we immediately tried to look at other options. So through other opportunities that we saw in this area here, we actually try to look at clinical pathology laboratories, and that's out of Austin, Texas. By the way, with LabCorp, we sent our specimens to Burlington, North Carolina, and just getting there to Burlington, North Carolina took about 2 days, and it took about the other days before we got our results back. But CPL Labs in Austin, Texas, it took about 24 to 48 hours, and then we got those back. And then CPL has actually increased their volume, and their turnaround time has actually increased to 4 to 5 days now, which hadn't been satisfactory. We've tested 13 with them, but the problem with CPL Labs is that they required viral transport media. Viral transport media was the primary denominator that prevented a bunch of people to send out these tests, because this was the hardest thing to get in the nation. As a matter of fact, we were actually struggling trying to acquire this stuff. And all it is just a liquid container that has a preservative that keeps the virus RNA intact so it doesn't break up, and that it actually can preserve the virus in transport so they can have accurate results. And we had no other methodology at the time to really make sure. But since these were all being used up, this formula to make this stuff was difficult. And finally, we were given the formulas to make this viral transport media. But during that time, our turnaround times were still not the best.
Mhm.
And just to make the viral transport media was very difficult to make, of getting the raw ingredients to make it.
Mhm.
So out of the goodness of Texas Tech University School of Pharmacy in Amarillo, Texas, they actually donated 100 vials of viral transport media to us, which we appreciate very much. But it still wasn't fast enough turnaround time for us for our patients. So we
Mhm.
actually looked again, and we actually decided to use, through discussing it with our medical director, Dr. Lola Windish, and myself, we decided to look into what has been talked about was sputum / saliva testing, which had a better recovery of the actual presence of the virus than if we use nasopharyngeal swabs. So
And it's more comfortable for people too. Just, you know.
yeah,
I
it's easier
believe
to
that.
collect and all this stuff. So these sterile specimen containers are easy to acquire. We have over 3,200 of them versus the 15 that we had and the 100 that we had from
Mhm.
the pharmacy school. And so we were able to collect these specimens and use this. And the turnaround time from this company called Microgen DX, actually out of Lubbock, Texas, turnaround time was in the same day or in 24 hours. And we're just very ecstatic about that. And that actually,
Oh.
I think we're ahead of the curve on a lot of cities now.
Yes.
And we're very
Mhm.
grateful for this company. It just happens to be they're based out of Orlando, Florida, and they have a second laboratory out of Lubbock, Texas, and they do, and I'll say, 10,000 tests a day with
Wow.
COVID virus. They're not at their maximum, but they are there. They use PCR testing there, of course. This is the same testing, but they have 9 Roche light cyclers that they use, and they can do 480 tests on this cycler machine. And so it's a very impressive laboratory. So I want you to know that it's a quality laboratory with quality results. And so the issue is just getting a quality specimen.
Well,
Sure.
and I think what Bill mentions is really important. So all of these are still the real-time PCR test is still being performed, essentially using the same methodology.
Mhm.
On March 27th, though, we did get some news that it will be a game changer for us. I think it was middle or late of last year, Bill had already gotten the Abbott ID Now testing system, and we use
Right.
it for our rapid strep
Mhm.
and rapid flu.
Mhm.
Well, on March 27th, Abbott received FDA approval for a different time. It's not the RT-PCR, it's the, what is it?
It's an
The
isothermal
Yeah.
Okay.
isothermal nucleic acid amplification.
So
Way over my head.
it doesn't require the same kind of like temperature
Right.
criteria, and it can be done point of care.
Mhm.
So that means that the test result, we wouldn't have to send it off. We
Right.
can have results, in a matter of 15 minutes, hopefully.
Okay.
Yes, we have 12 of those analyzers in our laboratory now, and there's a lot of people in our laboratory who know how to operate that piece of
Mhm.
equipment. And we have been asking Abbott for those test kits. Of course, their hands are tied because states and governors,
They have to go to the priority
Absolutely.
spots.
the priority
Yeah.
right now.
spots.
Yeah.
Yeah.
But you mentioned that we have 12 of those. Like at the
Mhm.
time that this was approved, there were 18,000 in the country. So
Wow.
there are people who are wanting this. They don't even
Right.
have
They don't.
machinery.
Yeah.
So we've
Mhm.
got it.
Yeah.
Everybody's familiar with using it. We're just waiting for those to be released to us.
Okay. So it's getting better and better all the time as we go along. We
And we
started
can
out
do it
with just a
in-house.
few of them,
Yeah.
and it got longer and longer on the wait periods, and then you change companies and got shorter wait times, and we're at shorter wait times even now. And then it could be just in a matter of time where we're just getting results within minutes.
That's why it's really important for me that the community know. I mean,
Mhm.
we have been trying every possible means,
Absolutely.
knocking on every door, trying, every avenue that we can find so that we can test more widely.
Yeah, and it's not just us, it's every community in the United States that's doing the same thing. We just happen to be ahead of the curve because we had that foot in the door already with LabCorp, and then the foot in the door with Abbott now. So uh, that's
Yeah.
really good news. So we have 3,200 of those tests, or of those
Yeah.
containers
Yes.
that we can do testing with. It's a possibility that this company could get backed up as well.
There's a possibility
It could happen.
it could happen, but um, they are ready to take the challenge. I mean,
Mhm.
they were one of these companies could not actually perform these tests. There actually are a DNA sequencing lab that actually does genetic sequencing for bacteria. And when they got the genetic code for the COVID virus, they were able to do DNA sequencing with that on their analyzers. So they actually limited their business on doing the microbiology sequencing for their genetic DNA sequence. And so they're doing it all on COVID now. And
Mhm.
so it's really good. I mean,
It's amazing the rate of innovation that has occurred on
Oh,
every
absolutely.
level.
Yeah.
But particularly with, for lab testing to go from, nothing virtually
Right.
at the beginning of March to
Mhm.
now having all kinds of labs and different methodologies. We talked about the RT-PCRs and the INAAs,
Right.
and then there's it's last week, April 10th. Antibody testing. One company has been approved for antibody testing. Now, that's not going to necessarily help
Sure.
us on the diagnostic
Right.
side, but it will help us as a population to
Mhm.
learn how many people may have had it, what kind
Sure.
of herd immunity we can
Mhm.
expect. So that will help us in mitigating and planning, for kind of our recovery efforts.
Absolutely. Yeah. Yeah. That's going to be very important to know. I've heard that there's some research going on some of those that have already had the COVID, and they're being tested to see. Um, there was a husband that had it and a wife who didn't have it, but she tested and positive, but didn't have any symptoms. So they're trying to figure out why.
Yeah.
So they're trying to. Is she immune? What's the story to that? So that'll definitely help out.
Yeah, and when,
So
when we look at things like mortality rate, well,
Mhm.
it depends on how many people were infected. We
Sure.
don't know.
Yeah.
So we don't have enough data to
Mhm.
make decisions and about some key things. So they are looking at that. This company, I believe, had done in Telluride at the beginning of. They tested all of the entire population.
Really.
So they're looking at. They're now trying to start to get to some widespread data.
Mhm.
And last week, the National Institutes of Health has opened up a research study, and they're asking for people who haven't been diagnosed or who
Mhm.
don't think that they have symptoms, if they want to participate. They'll go through a little tele exam and send
Right.
them a testing kit, and they're looking for about 10,000 volunteers.
Oh, wow.
So we'll see about making a link available to the
Sure.
National Institutes of Health if people are interested in participating and kind of helping be a finger stick.
Absolutely. Yeah. Now, I can't just walk into the hospital and say, I want to be tested, correct?
No.
There's still criteria to it. We have a lot of tests, but you can't just walk in and say, I want to be tested. What is the criteria to be tested at this point?
Well, right now we are testing all of the anyone who's admitted for inpatient care
Mhm.
because our inpatients are in very close contact with all of our healthcare providers, and
Mhm.
we want to make sure that both sides are healthy and stay that way. Well, obviously not healthy if they're going to
Absolutely.
be admitted,
Yeah.
but we want to not transmit any of the virus in that
Mhm.
way if possible. Um, people who present with symptoms,
Mhm.
with fever, with cough, shortness of breath. If there's anything that prompts our physicians to suspect that it could be COVID,
Okay.
then those people are going to be tested.
Right.
And really grateful for that. And it's I know it's been really hard on our providers who've really wanted to test and needed
Right.
to test and to have their hands tied in that way. So
Right.
so still, symptomatic and
Mhm.
having to have close contact. People who might have had a really substantial exposure risk
Right.
and may also be people who are in contact with a lot of people. We
Mhm.
want to test those people.
Okay.
We want to not have any super spreader events if at all possible.
Sure. That makes a lot of sense. Also, I think y'all put out on your web page that you're going to be testing obstetric patients, OB patients,
Yes.
if they're going to be having a cesarean section or they're going to be induced, and they'll be tested 2 to 3 days before that. Is what I'm
Yeah,
understanding.
if we know that they're coming in and we can kind of plan for that, then we
Mhm.
want to do that. Again, a lot of people are going to have very close contact
Sure.
during that time. So
Mhm.
we want to keep everyone safe as much as we can.
Okay.
I just want to reiterate, our
Mhm.
hospital is doing everything it can to prevent having any COVID or coronavirus COVID-2 in our hospital, and we're trying to protect all patients, all employees, anybody that takes a step in there. I know there's a sensitive button out there for the community to try to be hesitant to come to the hospital because they think they might catch the virus, but in reality, that is so far from the truth that our hospital actually is taking some very protective measures to make sure everybody is safe.
Mhm.
And we've actually are very conscientious about this. I mean, we have daily meetings, um,
More than daily.
or more than daily meetings to keep up a daily inventory of
Right.
our personal protective equipment. The people that's involved in all that is just so much energy is put into that, and time and allocation and inventory.
Now that said, we still want everybody to stay home as much as possible. That's still something that's key because
Right.
because we can't test everybody
Right.
yet.
Yeah.
So we do, so call ahead. If you've got a
Mhm.
question or a concern though, call. I mean, we are finding all kinds of ways to make sure that we can evaluate people and get people care. It may not be the way that we've always done it. It may
Sure.
not be the way that we expect to, but we will find a way to get people what they need. But do call first when possible.
Right. Well, my understanding is telemedicine out here has exploded
Yes.
since we've started all of this, and so I've used it a few times myself, and I I know if you don't feel good, you don't feel like getting out, and so that is really a big plus if you don't to keep yourself
Yes.
at home and to get that interaction with the doctor. So how is that going out there? Is it doing well?
We've gotten a lot of positive responses. I've spoken with some of the clinic nurses last
Mhm.
week, and patients are liking it.
Good.
They're responding favorably. I had a I had a telehealth visit with my doc, and it was really nice. I didn't
Yeah.
have to wait in the waiting room, and
Right.
I was able to keep working. And whenever he was ready,
Mhm.
I got on. So no time lost. I didn't have
Right.
to worry about being amongst pathogens or getting
Sure.
sick from something that someone else had, and
Mhm.
it was really nice.
Mhm. Yeah.
That is
I
fantastic.
do want to add one more lab.
Yeah.
I don't want to neglect all the labs we use, but the bioterrorism response lab out of Lubbock, we actually use that laboratory as well. Um, y'all have heard of Dana Hartman. She's actually works closely with that laboratory, getting approvals or requesting approvals or approving the use of the laboratory for us to get a guaranteed 24-hour turnaround time for sending specimens there. So that's such a vital process in this whole picture as well.
Mhm.
So we have 4 different laboratories we have the ability to utilize. We're using one more than the other, but we do have all these avenues to get quick turnaround times on that. I just want to,
Well, that's
And I
great.
think
Thank
that's the
you.
key. I mean,
Yeah.
we haven't put all of our eggs in one basket. As soon
Mhm.
as things, became available, we
Right.
have availed ourselves of that, and we're constantly looking. We're not just going to,
Mhm.
take it easy and think that everything's going to be okay. We are looking and trying to see what's around the next corner and
Right.
know how to adjust so that we can be in front of it as much as we can.
yeah, we want
Most
to be ahead of the
definitely.
game. We want to be up in front of the curve.
Yeah, definitely. And my understanding is that we are ahead of the curve in all areas here in Scurry County.
But don't
And
relax.
don't relax.
Yeah.
Exactly. That is the other key part of that is don't relax. We're ahead of it, but we need to stay ahead of it.
Yes.
Yeah.
If we go back too soon, we'll have an explosion of COVID here in this community, and we don't want that. So, is there anything else that y'all would like to discuss or let people know about?
Well, I just want to, this wouldn't happen with a lot of people who's involved behind the scenes. And this is the time that I just want to recognize some of those people. I don't think y'all realize, but Wanda Torres is the one that collects our specimens out there underneath the overhang of the main entrance. And for her to actually do that job, and with the physicians that go out there, I mean, I'm so um, thankful for her to give up her time and energy to take that role to collect those specimens for the COVID tests. So uh, thank you, Wanda, for that. And then also, believe it or not, we have to actually drive these specimens to Lubbock or drive them to wherever, Abilene, Texas, or wherever we have to drive to. So actually, we have couriers that actually on a daily basis drive back and forth, back and forth. So I'm just gonna say Laura, Felicia, Elvia, and some of the other unnamed couriers that will be used maybe in the future. I just appreciate them having time and energy to go do that. And then just the people that are up front in the main entrance of the hospital who are doing the screening. I mean, that is a serious but very vital and important role. And those people
Mhm.
are vital to the success of our hospital, making sure that everything is done right. I mean, a lot of people in the hospital are vital.
Mhm.
I'm not trying to.
Our cleaning staff also. Oh my
Oh
goodness.
yes, the cleaning
Erica and her
staff.
team,
The
they've
cleaning
been
staff.
their routines have been, increased
Right.
substantially.
Yeah.
And I mean, they do a great job anyway, but man, they have just really, really been doing, and that's a key thing too.
Yeah,
We know about
absolutely.
hand hygiene, but
Mhm.
environmental hygiene, keeping everything clean is
Right.
so important. And they've just
Absolutely.
they've really been working hard.
Yeah, I mean, there's a lot of people you can name,
Sure.
but I just want to stress on, since we're talking about regarding specifically the testing collection occurring at just these people in general.
Yeah.
And so I appreciate every single one of them. I mean, they mean a lot to me.
Thank you. Thank you. Is there anything that you would like to bring up or remind everybody or?
I can't. I've been just absolutely. I mean, the teamwork and the innovation, and it, it has really been inspiring.
Mhm.
And I am pleased that we are where we are right now. That we
Right.
that we haven't experienced some of the worst case scenarios that we've seen in other places. And I'm grateful for that. And I hope that we are able to keep it that way. And to that end, I really really want to remind everyone how important it is to maintain the social distancing, to wash your hands, stay home when you can, stay home when you're sick. Now, you need to be doing that all the time
Right.
anyway.
Yeah.
Yeah.
Um, and and to be patient. I know it's hard,
That.
but getting through this in healthy and whole,
Mhm.
it's a marathon, not a sprint.
Absolutely. Yeah. And that's the key that we've been trying to get people to really understand is be patient. This is going to take some time. We're going to get through this, but it's going to take some time. Well, thank you both. I appreciate you coming. There's just a couple of things that I want to mention real quick. I want to remind people that the parks are open, but don't use the equipment. They're not being sanitized. Don't have large gatherings in the park. Preferably don't have large gatherings at all, but don't have large gatherings in the park. If you do, you're going to be asked to disperse. We've been trying to stay away from that, but we're seeing that people are starting to gather again, and we're trying to prevent that. We're trying to stay away from getting those large numbers of cases like other communities have. So if you're in a large gathering, you'll be asked to disperse. Now, if you're doing your distancing, you're going to be fine. Don't worry about that. One last thing, Tammy at the Senior Center wanted me to remind everybody that the Senior Center is still delivering groceries for the seniors. So if you have a senior that in your family that needs groceries delivered, call up the Senior Center. There's a certain days that they're doing that for the seniors, and I don't remember if they're doing it every day, if they're delivering groceries every day for the seniors. I think it's just on those specific days. But call the Senior Center, and they can get you taken care of. With that, we're going to let you go and let you have a great afternoon, and we'll see you again tomorrow. Thank you.